Well, happy Monday, everybody. I'm absolutely thrilled to have here with us an amazing lady, always working in the community, still working in the community. Will probably still be working in the community by the time you watch this short brief. But may I introduce to you the wonderful Beverly. Beverly, hello, welcome back from holiday. How was your holiday? Tell us a little bit about yourself and what you do in the amazing County of North Somerset, and specifically for us here at Peer Hill Group.
Thank you, Brandy. I had a wonderful holiday, thank you. Just settling into our new home. So I feel all relaxed and organised now.
That's what we like to hear. Well done.
I work in the social prescribing team in North Somerset, as you said, for the Peer Health. We work very closely with the GP practices. They're trusted members of the community and people like to talk to them. Or sometimes people go to the GP practice with a medical condition and a social condition that's affecting their health and well-being. And sometimes they just go with something social that's affecting their health and well-being. So the GP practice can help them with anything medical, and then if there's anything that they feel that the social prescribing team can help them with, they will come to us with through a referral from the GP practice. It doesn't have to be a GP, it can be anybody that works in the GP practice, and at some practices you will be able to self-refer by speaking to the receptionist.
So that's an interesting point, isn't it? Because we're so glued in our society to just go to the GP with everything, don't we? So we cannot just go when we're feeling a bit down or not too well, or in general, sort of a rocky well-being. And I guess that's what you're trying to say, aren't you, in terms of we go there. And so how do you then, how is it filtered? I'm interested to know. So somebody goes to their GP with a few social challenges. How does it filter back to you in social prescribing?
Well, the practices, they can refer straight to us, and then we'll pick up that referral. We contact people within 5 working days generally. Sometimes it gets a little bit busy, and then we can either book an appointment to see them face to face, so we can go for a walk and talk, we can visit home visits, we can meet in a cafe, whatever suits them. I think we've met in libraries before. It's really community based, so wherever they feel comfortable, that's where we can meet somebody. And I think the important thing to remember is that there's a lot of things that can impact your health, because if you've got anxiety or you're stressed, it will impact on your immune system as well, so you will probably feel ill. We have a lot of referrals through for housing, debt, financial support, employment. So there's lots of reasons that could be impacting somebody. We also have low to moderate mental health referrals through, so that we can help people navigate the community services, like peer support groups, things like that. And we also refer on to Vita Minds if needed. So there's lots of reasons why people come to us. We also have a lot of people coming across for loneliness and isolation, and it's there is a preconception that it's older people, but it's not always. We have had 18-year-old referred through, and we have a lot of like 50 to 64-ish referred. I think COVID had a massive impact on people's ability to connect, and some of that's been lost now, so it's just reconnecting people with the things that are going on in the community. North Somerset is a wonderful place to live. We have so much in the community that we can access. So that's what the social prescribing team's there for.
So can you just bust this myth for me? Because before I worked in healthcare, I generally assumed that social prescribing, once you've actually had that conversation, you get a prescription document to go and get something. Just bust that for us in case there's anybody out there thinking, I thought the same, Brandy. Tell us about that aspect of it, because it fascinates me. what I can't understand
Yeah.
why I thought that.
I think the title is a little bit confusing, and it can be confusing when we ring up and we say, oh, for the social prescribing team, and they say, oh, you got my prescription? We say, not quite. But it is, I think the concept is that the GP prescribes medication and we prescribe social
Got
activities
it.
or
Got it.
whatever's needed. You don't get a physical prescription. We will have a conversation with somebody, like I say, in any environment that it suits them. And it will be all about what matters to them. So what's impacting their lives, what's worrying them, what's not working so well, and what's working well. You know, it's sometimes we get so tunnel vision, we don't realize what's going on around us that is working well. So that conversation can help, that we can unpick what's going on. We can spend, you know, up to an hour, sometimes more, with somebody if that's needed. And it's just really listening to what's happening to them and helping them navigate what's available to them. We don't want people to become dependent on us because we can't stay there forever. So we're there to make them independent and to start living a well, happy, healthy life.
That absolutely makes sense. I mean, the beauty about North Somerset is there's all these wraparound stuff, certainly around primary care, that some people don't know about. And I'm very fascinated and really excited about the journey that you take people through, because of course they leave us as patients, they then become clients and customers to you, and then you work with them to be dropped, quote unquote, into the community as citizens. How does that journey often feel? Does it feel rocky, or does it, are you able to kind of smoothen it? And what is the outcomes that you normally have?
Yeah, I think that's really interesting, because once we've got the referral through, that very first phone call is explaining all about the service. You know, a lot of people do know about it, but there's still people that are a bit confused. And when you're in a GP practice, sometimes your mind's not working quite the same as if somebody was just chatting to you over a cup of coffee, so they haven't quite picked up what's going on. So we'll do that, and if there's anything urgent that needs doing there and then, we will do that. So we do have requests for food vouchers sometimes, you know, or somebody's homeless and we've had somebody living in a car. So obviously, as soon as we've spoken to that person, we will try to assist them as best we can then, and then we'll make another appointment. It can be on the phone or, like I say, in any environment that suits them. And that's where we'll sit and we'll talk about whatever we need to be doing to help somebody. It's a bit like a hand-holding service.
Mm.
So, you know, we're guiding people through what could help them. And I think we do get lots of really good feedback from clients. We've had 3 ladies that have attended the same group with the same link worker, and they've made friends. So that was a really positive outcome. We've had people that haven't been out for a long time that suddenly they've joined groups and they feel like they're getting their life back on track. And then on the other hand, we've helped people access the services like citizens advice or support workers or Vita Minds, where they need that extra support that we can't give, but we can help people access the support. We've had one client who needed sign language interpreter. So the link worker liaised really closely with the citizens advice worker so that that person could, you know, actually get what they needed at the time. And we're very busy. I'm not saying we've got loads of time, but what we do is the person we're dealing with at that time is the only person on our mind. We've got the, you know, the waiting list behind us a little bit. And that's, I think, the you know, the gold standard of this service is that we have time to talk to people and help them through their journey so they get to that stage where they are feeling well. And some people just want to talk, and they find their own solutions because they've just voiced what's been going on in their life.
I
So
mean,
yeah,
It's just awesome. You know, I don't know whether you know, but if you don't, I'm letting you know that we know that you do a great job, you guys, as the social prescribing team. We appreciate you. Not sure where we would be without you. So thank you. It's an amazing place to be in North Somerset, because we've got, like we said, we've got all these things wrapped around. Appreciate you, appreciate your time. I think what's fascinating, Beverly, also is because you come at it from a nursing background. And so from a personal note, thank you for all you do. Now, if there's anybody out there that doesn't know about social prescribing and have heard about it today, fascinated about the service, how do they get? Can you self-refer? I think you mentioned, can you self-refer? What do they do?
Yeah, you can self-refer in some GP practices, but you would have to go into the practice or telephone the receptionist, and they will send the referral through. Because it's an electronic referral system at the moment, that's the way we get the referrals. Well, we are hoping that things will change, you know, and people will be able to come into a sort of virtual hub, and then they will be able to go out into the social prescribing team. So, you know, I think it should be in the community, but at the moment, the way it sits, it's with the GP practice, and it's because it's set up to help the GPs navigate the social aspects of their care, the patient's care.
Yeah.
So the best thing would be to contact your GP practice, I'm afraid. But obviously, if you want to put my email address at the bottom of this video, I'm happy to answer any questions that come up after watching the video. I'm so passionate about it. I don't know whether you can tell.
We can always tell, Beverly. We know how passionate you are about this. You don't come into this lightly without the passion. So listen, thank you. It's been awesome learning a little bit about social prescribing. We appreciate you. And thank you very much, Beverly. And especially for coming on day one back from holiday to talk to us. Appreciate you.
Thank you very much.